Thank you so much, Mike, for that kind introduction. It's a privilege to join TASH and the disability community in recognizing the important contributions of today's special honoree, Michael Lotman. Michael Lotman has played a critical role in some of the most defining legal cases in disability rights, starting in the early 1970s. These cases not only changed the lives of the thousands of people he represented, they also had ripple effects across the country and spurred movements for change nationwide. The start of Michael's incredible legacy was his work to address the horrors of Willowbrook. All of us have ingrained in our minds the shocking and outrageous abuse, neglect, and segregation that was shown to the American public on our TV screens. But not everyone knows the decades of long and hard work it took to challenge and eventually remedy those horrors. Michael, as a young Department of Justice attorney, was a champion for people with disabilities at a time when we had too few voices in the halls of power. His groundbreaking legal advocacy created precedent that formed the basis for scores of lawsuits fighting against abuse and segregation of people with disabilities in institutions and for the right to community living, becoming the impetus for the Americans with Disabilities Act and the basis for the Supreme Court's Olmstead decision. He negotiated a first-of-its-kind remedial order at a time when there was no such thing as home and community-based services, having to come up with this rival image to institutions from whole cloth. All of this would have alone been amazing. But as someone who has been involved in system reform litigation myself, I know the hardest work begins when you have to turn the promises from lawsuits into reality for people. And that's where Michael's steadfast and unwavering work is so remarkable. Michael spent decades ensuring that the promises of the Willowbrook consent judgment came to fruition. And then he took that experience to make sure that the promises of other lawsuits inspired by his work on the Willowbrook case were also kept. The list of cases where he has played a pivotal role is like a who's who of the most important cases in disability rights law: Willowbrook, Pennhurst, Mansfield Training Center, and Clover Bottom. These are the cases that not only broke legal ground and created precedent in disability law, but they also spurred the disability rights movement itself. Because of Michael's work in the late 1970s, families like mine were able to reject the advice of doctors to institutionalize children with intellectual disabilities and to join together to advocate for a system of community-based supports. It is because of Michael's work that my brother and hundreds of thousands of people like him are now living self-determined lives as valued members of their communities. And on a personal note, it's because of Michael's work that I had the privilege to follow in his footsteps many years later in the Department of Justice to launch an Olmstead practice focused on vindicating the rights of people with disabilities to live and fully participate in their communities. Disability justice is a long arc centered on a promise of full inclusion and equality. The North Star is a recognition that with appropriate services and supports, each of us can live self-determined lives and achieve our potential. Each of us have the right to live with the people we choose in a place we call home. We all have the right to education and employment and the right to live our lives as independently as possible. Today at the Administration for Community Living, we continue to build on the foundation established by Michael Lotman and many others, including many of you who are listening in right now. We are fighting for a number of priorities, which I'd like to briefly touch on. COVID-19 has had a devastating impact on people with disabilities. People with disabilities have faced higher risks of infections and death, lost critical services, have been socially isolated, and face barriers and sometimes even outright discrimination in accessing vaccines, PPE, and life-saving treatment. ACL is continuing our fight to ensure that every person with a disability has equal access to COVID vaccines, treatment, PPE, and tests. We fought for and secured significant funding for our aging and disability networks to help address barriers during COVID and to partner with and build disability expertise in public health systems. We've set up the first federal national disability hotline, helping almost 100,000 people with disabilities connect to services and supports to help them through the pandemic and beyond. And we've successfully partnered with the Health Resources and Services Administration to get tests and masks to people with disabilities and older adults who face barriers in getting them through other pathways. We've worked with HHS's Office for Civil Rights throughout the pandemic, including to produce guidance on crisis standards of care to ensure that people with disabilities do not face illegal discrimination in accessing life-saving treatment. And we're now working with OCR on updating the Section 504 regulations, a critical tool in protecting the civil rights of people with disabilities. This is the first significant update in 45 years. At ACL, we are also maintaining our steadfast focus on expanding access to home and community-based services. We've recently launched an initiative to address the direct care workforce crisis and are leading the development of a national caregiving strategy to help support family caregivers. We are working hard on implementation of the HCBS settings rule, including ensuring strong input from people with disabilities and their families. We are addressing the shortage of accessible, affordable, and integrated housing that's impacting people with disabilities, including working with HUD and other partners to address the fact that it's often the lack of housing that's the barrier to transitioning people from institutions back to the community. ACL continues to work to advance policies to expand competitive integrated employment and end sub-minimum wages. Building from interagency guidance we joined last year that highlights new resources to expand competitive integrated employment, we will be releasing several new interagency guidances over the next several months. And finally, we are addressing equity in all we do, using an intersectional lens to help identify and remove barriers that people with disabilities face, recognizing the diversity of our community, that people with disabilities may also be from communities of color, LGBTQ, not speak English as a first language, live in rural areas, etc. I have not touched on many of our programs for the sake of time, and because I want to close with this. Thank you to all of you for what you are doing and for what you will continue to do to support the disability community going forward. Thank you for your advocacy and for the supports you provide. To all of the advocates with disabilities listening today, we need your voice in the room most of all. Thank you for demanding your rights, and thank you for all of your work to make America a truly inclusive nation. And finally, to Michael Lotman, thank you for a lifetime of devoted service to your country and to all of us. We are a better nation because of you, and we must all strive to live our lives with the passion for justice that you have shown throughout your career. Thank you.